A warm welcome to everyone joining us for this panel, in which we will explore the experiences of Africa-based fact-checkers around the pandemic. There certainly has been brisk growth in fact-checking on the continent, with 19 operations so far, according to the latest census by the Duke Reporters Lab. Interestingly, nearly half of those have come in the last year or so. But when you consider the continent's population of more than 1 billion, and that there are nearly 300 fact-checking organizations globally, that seems like an underrepresentation. We will, with my panelists, whom I will be introducing shortly, explore the structural issues around this. In many ways, the environment fact-checking in Africa finds itself is much like in other societies. More connectivity means more competition for clicks and digital eyeballs. Much the same, from for-profit to propaganda, and finding rich ground in the crisis of the day. The platforms used to seed false information are familiar. Like in other regions, we in Africa focus on issues of social benefit and that people care about, such as health. We ask ourselves pretty much the same questions about impact, about scaling up our work, and about breaking out of urban ivory towers. But in many other ways, there are differences. Worldviews in Africa, for example, are more communal rather than ideological and are very experiential. We emphasize relationships. We inherently believe the intentions of others are idealistic. We tend to have very young populations. Culture plays a major role. Our societies are still very much based on hierarchy. I could go on and on, but in a nutshell, in the search for solutions, we would do well to remember that no one approach fits all. To shed more light on this, and without further ado, I will now ask my panelists to introduce themselves and to give us a brief overview of their organizations, as they will do a much better job of that than I could ever hope to. I will start with Dubawa in Nigeria.
Thank you, Lee, and the organizers of this conference, Babers, his very many emails, and his team, Chris and Feli. I keep gushing about how well organized and choreographed this conference has been, and I'm really excited to share experiences with my colleagues here in Africa. And to everyone watching, good morning, good afternoon, and good evening. My name is Ebele, and I work for Dubawa, a fact-checking organization in Nigeria. In 2018, our brilliant executive director saw the need to set up a verification platform to not just complement the work of Africa Check and AFP operating in Nigeria, but to also train journalists in newsrooms across Nigeria, because misinformation, disinformation, malinformation, propaganda, fake news, and all other pseudonyms, this is just a very big, scary monster, and that requires a multi-pronged approach. Today, with a core team of 8, Dubawa has produced over 439 fact checks hosted on our website and distributed across social media, trained over 250 journalists, initiated and coordinated a major alliance with 5 journalists in major newsrooms in Nigeria, somewhat similar to the Coronavirus Alliance, but on a very much smaller scale. Implemented a 1-week media literacy campaign that saw the participation of more than 1,000 people across Nigeria, and produced a research report on the impact of election monitoring as an approach for combating misinformation in Nigeria. In February, we expanded to Ghana, and our program officer and her illustrious team are doing great work fact-checking the coronavirus pandemic and also preparing for the Ghanaian elections coming up at the end of the year, securing partnerships with NGOs like the Alliance for African Women Initiative and local radio stations, the most popular means of communication in Ghana. So once again, it is my pleasure to be here, and I'm looking forward to our conversation.
Thank you, Ebele. We also have Pesa, which is headquartered in Kenya.
Thanks, Lee. So Pesa is a fact-checking organization based in Nairobi, and we started out in 2016 with the aim of looking at misinformation around how, and reporting around how budget and public finance issues are reported on and looked into in Kenya, and we grew slowly into Uganda and Tanzania. But eventually what we discovered was that the false information and misinformation around budgets and public finance wasn't just around budgets. It was a symptom of a much bigger problem within how the media was communicating certain issues in Kenya and in Uganda and in Tanzania, the other countries that we were operating in. So we grew our focus into more general fact-checking. We started looking at delivery of public services, how governments were implementing the plans that they had made for their citizens. And then the other thing that we tried to find was also credible data to make it accessible and available to journalists in these countries. So to that end, we partnered with the International Budget Partnership in Kenya to look at data and reporting around budget and public finance. And we also looked into social issues in the other countries that we're operating in Uganda and in Tanzania, where a lot of the claims were related to things like health and also education and other things that touch on the delivery of public services and show just how well governments are delivering on their mandates to their own citizens. So we also work with community media and community radio stations in Kenya, where we have tried to set up verification desks in these newsrooms. And to that end, we also have localized a lot of our fact-checking content to be repurposed and republished on these platforms, on these stations, because as Ebele has mentioned, community stations are a really good way to really connect with the public. And our job is to make sure that they're consuming information that's credible and verified. And the other thing that we've noticed in our fact-checking work in all of the countries that we're in, so right now we're in 6 countries, and we're about to expand into another 3, is that false information and misinformation a lot of times is very closely linked to elections. So a lot of times the way it works is before elections, there's a certain level of false information that's circulating and that people are falling for. And then during the election process, there's some false information that comes in. And after elections, there's a reduction in the level of false information, but then it doesn't really go back to pre-election levels. So elections almost mainstream the production and the consumption of false information. And one of the things that we've also seen is health misinformation as well is something that's deeply personal to our audiences. And it's something that a lot of people care about, especially now with the pandemic. And one of the things that we also try to do is to connect people with the experts and the data that they will need to debunk a lot of the claims that they're consuming on various platforms, so messaging platforms, social networks, and even from mainstream media. So our aim is not just to debunk false information, it's also to make sure that the people who are consuming information from all of these different platforms know what to look out for and make sure that they don't actually fall for false claims. Thanks.
Thank you, Eric. We will come back to if we are reaching vulnerable communities later on in our discussion. But for now, I will invite GhanaFact, one of the newest members of the IFCN family.
GhanaFact, it's the newest fact-checking project on the block. Amongst the members of the panel, we are the newest. We just launched last year in August and published our first reports in September. And between that, we've managed to become now signatories to the International Fact-Checking Network Code of Principles. So GhanaFact is Ghana's first full-time fact-checking organization that is now signatories to the International Fact-Checking Network. Since we launched, we've managed to be involved in 1 or 2 collaborations. We are now part of the IFCN Covid-19 Alliance, which is helping tackle disinformation around the coronavirus. I should also mention that we are part of the Info Finder project by Africa Check, which is the pioneering fact-checking organization on the continent. Basically, it has brought together some fact-checking organizations on the continent, including GhanaFact, ZimFact, and also Dubawa, to create a repository of facts for people who serve the net on the continent. So these are the 2 projects we've been involved in outward. But here in Ghana, we are trying as much as possible to build a community of fact checkers in Ghana through trainings. So we have tried to do some trainings for about 200 students, journalists, and also news editors. The most recent trainings we did for news editors was, I think, last month, where we got about 6 news editors across the country and did some trainings for them as we try to expand fact-checking and expose people to some digital tools that could enhance their work in terms of doing fact-checking and verifying information. So GhanaFact is on, and we are trying as much as possible to kind of collaborate with mainstream media organizations, because in Ghana we have radio and television being the leading outlets where people consume their news. So the most recent collaboration we've had with some mainstream media organizations is a partnership we've had with Ghana Web, which is the leading digital platform in Ghana, where we are hoping that anytime we produce fact-check reports, that would be republished on their platforms. We are hoping to expand these collaborations, so anytime we produce some of our fact-check reports as a third-generation fact-checking organization, we don't just aim to publish reports. We hope to hold people accountable and ensure that the right information is pushed out there. So through these collaborations, we are hoping that we can achieve objective of not just fact-checking, but holding people accountable.
Thank you very much, Rabiu. You sound very much like a first-generation fact-checker. Clearly, you've been very busy, and I mean that given how young you are as an organization. So, fantastic work. Unfortunately, our last panelist, Sammy Mupfuni of Congo Check, is not able to join us today, but he has recorded a quick video which we'll play now, just to say hello and to contribute to the conversation.
Hi Lee, hi everyone. My name is Sammy Mupfuni. I'm the directing manager of Congo Check, which is the first fact-checking organization in the Democratic Republic of Congo. We have been working now for 2 years with a team of 20 people. So when our country, when the first COVID-19 case was confirmed in our country, we didn't imagine, we didn't believe we could face false rumors and disinformation on this disease. It was when we started to see messages like those saying that Black people don't die from the coronavirus disease, or those saying that the hair found in the Bible could cure the COVID-19, we realized that it was starting to take a different dimension, because we've learned a lot, we gained a lot of experience in covering the Ebola epidemic. For example, during the Ebola epidemic, apart from people who were killed by the disease, agents working in the Ebola response were attacked or killed while trying to save lives. And in March, at the end of March, we decided to, when we started to see those messages, those false rumors on this disease, the COVID-19, we decided to launch the Fact Check COVID-19 program. Because for us, it's a social responsibility. And for the same reason, we decided to launch the SMS COVID-19, which is a service consisting of sending fact check via SMS to people who have subscribed to this service. And now we have several hundred people who are receiving our fact check via SMS without having to connect to the internet, without having the need of the internet connection. Because although we are inspired by the fact-checking organization from elsewhere, we decided to adapt the fact-checking on our local realities. And the reality here in Congo is that people don't have access to the internet, but they are directly affected by the disinformation and false rumors coming from the internet. It is in the same circumstances that we recently decided to broadcast, to produce fact check for deaf and hearing impaired people in general, because again, here in DRC, those people don't have easy access to information. And we thought that during this COVID-19 pandemic, they are really exposed to misinformation, and which can cost them their lives. So we plan to start broadcasting those video fact check on local TV channels for reaching wider audiences. This is a brief summary of what we are doing now. Thank you so much.
Thank you very much, Sammy. Yeah, it was Sammy, true. And he has mentioned a few things that we will be discussing shortly, including innovation and new formats and offline harm and reaching vulnerable communities. I think that's quite innovative what they're doing with the deaf and hard of hearing. But first off, to get into a broader discussion, we are seeing the news cycles beginning to turn, even if ever so slightly. I guess that gives us some space to reflect on how we have fact-checked the pandemic and perhaps take some lessons that will benefit us on the continent, given many feel that the peak in Africa is yet to come. I saw a comment that the pandemic turned every fact-checking operation into a team of health reporters. I don't know how true that is, so I will ask you, just how prepared were you to tackle false information around the pandemic, and what changes or measures have you had to institute in your organizations? Perhaps I could start with you, Ebele, in recognition of the fact that Nigeria has the continent's largest population.
Right. Thanks, Lee. I think that's something we use all the time, our population. But with coronavirus, it was and it's still a novel problem. I mean, even though some epidemiologists had seen it coming a bit, but not to the extent. And even Bill Gates, who became a popular face for controversies around it due to his TED Talk in 2015, couldn't have seen the extent to which coronavirus would affect nations and economies. But to be honest, and if we're being very factual, Africa did have some time to prepare for it. I mean, in February 28th of February, when there was a total of 1,431 confirmed cases in the world, and 888 of those in Italy, Africa just had one confirmed case, and that was in Nigeria, of course. And also with the IFCN alliance, we cannot feign total surprise. But regardless, like I said, it's something that the whole world is battling with. And so our approach was to anticipate it, observe, and then iterate our processes based on our findings. Using Joe's analogy from the conversation earlier on lessons learned from Coronavirus Alliance, likening the infodemic to the day before a shooting and then the day after a shooting. And so what we did was anticipate the kinds of misinformation that we thought would travel across the country based on our experiences, fact-checking other sort of public crisis. And then we observed the trends and tried to change our approaches based on what we were noticing. One thing that we changed was that our fact checks became more of sort of like media literacy articles. There are a lot of explainers, and that was not just because of the nature of health fact checks, but also because of the volume and flow of misinformation. And so we knew that a lot of emphasis and responsibility had to be on the consumers of misinformation to be able to critique information that comes across them and not just the media. We also then expanded our team. So even as much as we became health fact checkers, we also included a medical doctor who had expertise, an in-house medical doctor, so that if we had questions that were beyond our control, we could just easily reach out to him. We also used a lot of partnerships and cross-publication. I think that's very important because about 4 of our fact checks were based on information we'd gotten from Pesa check. So thanks, Eric, your team as well. So seeing that other fact-checking organizations had done similar things, and something we also noticed was that misinformation was very much cross-border, and this just shows that we all bleed the same blood, because you would expect certain kinds of misinformation to only be, and I think that's a very wrong notion anyway, to only be prevalent in, say, African countries. But then we saw Western countries and even leaders in those countries promoting certain kinds of information that you would not expect from someone educated. So it just shows that at the end of the day, our emotions and our sentiments really come to play the kind of misinformation and the way misinformation flows. And so we did a lot of reference to other fact checks. We also have partnerships with the Nigerian Center for Disease and Control really helped reaching other communities. So they were sending messages via SMS, WhatsApp, Twitter to so many people, and they have a very wide network. So that partnership was very helpful for us. We also had a lot of round the clock reporting, so we had to mentally prepare ourselves for fact checking at odd hours as well. And we also introduced a weekly newsletter that sort of analyzed the trends around misinformation. And we used tools like CrowdTangle, TweetDeck, answer the public so that we could personalize our insight based on what people in Nigeria were talking about. We got audience feedback, and we had tip of the week so that people could also just, again, placing more emphasis on the role of people. And yeah, so obviously there are things that we wish we had done better, and we're still learning, especially from this conference, and I'm sure we'll talk mostly about that later on.
Thank you, Ebele. Eric, did you see this coming, or how did you adapt to it?
I think, as I mentioned yesterday on the health misinformation panel, the way we always approached the fight against false information is by treating it as a disease or as a symptom of a disease. So what we try to do is to look at false information as a manifestation of information disorder. And the way it works is we identify the credible information, and then we plant that credible information as a cure, so that the false information that people might be seeing is intercepted, and then they're also able. It also acts as a vaccine, so that people who actually see false information after seeing our fact checks are able to prevent or to keep from falling for them. And I'd say the main thing that we have learned and that we're still learning is that there's a really big need for engagement with health agencies and credible government agencies, because as I mentioned, when we're doing public finance fact checking, the biggest challenge was getting information from governments. And one of the things that we've seen as a result of this pandemic is that suddenly the governments that were really hesitant to talk to us are now very willing to have their information put out there, especially because this is a crisis and it's completely unprecedented. And because it's the same sort of crisis that's manifesting in lots of different countries, as Ebele mentioned, you will see a story from a Nigerian outlet being published on a Kenyan social media page, and then you will also see the same story being published in another country, in another completely different context. And that's one of the lessons that we've learned from the Alliance, is that a lot of the times when we see a false story related to the pandemic, we can reach out to other fact checkers, and other fact checkers have actually reached out to us and asked us, we've seen this video coming out of your country, are you able to verify this information for us? Are you able to speak to someone so that they can actually clarify what it is we're actually seeing? And the other thing that Ebele also mentioned is the collaboration. So we've actually been able to collaborate with a lot of fact-checking organizations in other countries. So in the 2018 Zimbabwe election, we worked with Midan to partner with Site and ZimFact in Zimbabwe to set up a fact-checking initiative around their elections, and they're able to successfully do that based on the lessons that we learned from our experience in Kenya. And actually, before this pandemic sort of interrupted everything, we actually had a plan in place to go to set up a similar thing for the Ghanaian elections, which are later this year. So this also ties into this the thing I mentioned earlier, where a lot of times misinformation in our contexts manifests around elections and electoral processes, because these are times when the flow of information gets disrupted and interrupted. And then the other thing that we see is people try to take advantage of this information vacuum to push their own agendas. So likewise, with the pandemic, we've seen people try to push their own miracle cures. We've seen people try to undermine authority. So trying to question the effectiveness of certain measures, and then also start asking, like, does this virus actually exist? And that's why you see people walking around without masks saying, I don't know anyone personally who has the disease, even though you look at the stats and you see the numbers are growing every day. So there's a real need for us to build on the momentum that we built from this pandemic and from all of these collaborations and initiatives that are being put in place to sort of establish a more continental fact-checking initiative. So I know Africa Check has been doing quite a lot of work to bring us together. And this started out when it was just two of us in the room on the sidelines of the Global Investigative Journalism Conference in 2017. And then last year, there were 5 more organizations at the table, and now we have people like GhanaFact establishing their own initiatives in their own countries. So it's really wonderful to have all of these people doing all of this work, and it just speaks to the need for fact-checking in our own individual contexts, I think.
Thank you, Eric. I'll probably touch on my next question about the formats of false information we've been seeing. But Rabiu, I would think GhanaFact was thrown into the deep end.
Yeah, I think Ebele and Erica, they've done a wonderful job in terms of setting the tone for the discussion. In terms of the different forms of disinformation and misinformation we have seen within the period, they've come in amazingly a number of forms. We've seen text, we've seen audio that's going viral on WhatsApp and even on other social media platforms, including Facebook and Twitter. We've seen kind of unproven cures also going viral. And I should mention that it's quite impressive this time round that previously, where we were finding challenges in terms of getting information from state agencies and government, this time round, because disinformation keeps on coming in thick and fast. We've had like the Ghana Health Service in Ghana give up to minutes response to some of the disinformation we have encountered. You pick the phone, you call an expert there, and the person is willing to give you some information to either counter or confirm some disinformation that you've encountered. We have the Food and Drugs Authority here in Ghana, always willing to give information to either confirm or debunk some of the different forms of misinformation that we've encountered here in Ghana. So I generally think there is a problem that needs to be dealt with in terms of the coronavirus pandemic and people taking advantage of it, weaponizing disinformation. And the response that has come in has helped, but there is more to be done, because currently there is the easing of restrictions, and we've seen some people kind of change their ways in terms of promoting disinformation and misinformation. Where previously we were seeing audio, text, videos pushing misinformation, now we are seeing people do some form of promotions to push misinformation, job alerts to push misinformation. So this time around, we will need to get to private companies, some parastatals, some multinational organizations, even the World Health Organization, UNICEF, UNDP. We need to get to them sometimes to confirm if they have put out job ads, kind of encouraging people to apply for jobs. Some hoaxes that have also been promoted since we saw the easing of restrictions, kind of because of the difficulty people have gone through throughout the lockdown. People are saying there are coupons and discounts being given out. So you click on a link and it doesn't take you anywhere. You don't really know what you are doing by clicking on that link, but people do as acceptable to it. So people do click on these links. So change the way they are going about dealing with these and see the changes in.
Okay. Thank you very much, Rabiu, for that. And I know you've mentioned quite a number of formats of misinformation, which brings me to my next question. I listened to the IFCN's Chris Tarhadira. I hope I pronounced that right. I know it's a tricky second name. She says so herself. On the Coronavirus Facts Alliance panel. And she observed that early in the pandemic, the type of falsehoods that were observed were of the type that was about, or rather had less intent, and was more of people trying to keep themselves safe, themselves and their families safe. It would be fair to say that after this initial phase, the disinformation actors took over. So maybe I could ask Eric, what have been some of the key types of falsehoods you have seen in your respective countries, and in Kenya specifically, and what do you think are some of the factors behind this?
So the main things that we've seen tend to be people taking advantage of the paranoia and the fear around the pandemic to push like links. So telling people, for example, that if you click on this link, the WHO is hiring people to work remotely. So click on this link to apply for this job, and then it harvests your personal information, and then that information is sold somewhere. And the thing that we've also seen in a lot of situations is misinformation about vaccines. So there's been a lot of messages saying that the Kenya Medical Research Institute, which is the main medical research entity that's run by the government of Kenya, is actually running secret vaccine trials. And that, especially after there was a video, an interview on the BBC talking about how one of the plans for the test of the vaccine that Oxford was developing was to test in Kenya because of the level of exposure of the population to COVID-19 and the general lack of, I'd say, setups in the country to protect people from situations where they're taken advantage of. And so this situation got very played out. So a lot of people kept saying that they're coming to test. And then there's also the religious angle where people are saying COVID-19 is going to be used to put microchips in people's hands so that they can use those to transact. And so a lot of times, like, these messages were coming from other places. So we saw a lot of the 5G related conspiracies show up as audio, as voice notes on WhatsApp. Like, I actually remember my mother sending me a 30-minute voice note from someone at, I think from the UK, talking about how this it's a manifestation of the end times. But it shows just how international this is. This problem has become. So she had gotten it from a friend of hers, and then she sent it to me and asked me, "Listen to this. Can you tell me if it's legit or not?" So I listened to it, and then I was like, "Okay, this actually makes some very interesting points, but then they're provably false." So the ease with which this false information is debunked also speaks to just how low the level of trust people have in counter information, incredible information from other sources, to the point where they're like, because of that, because of the little trust I have, I'm going to spread this. And that's one of the main challenges that we've had to overcome.
Thank you very much, Eric. Ebele, what did you see? What kind of misinformation have you seen? And what do you think could be driving this?
So for us, prior to COVID-19, and thanks to the work of other researchers like Claire Wado, we're able to characterize three important aspects of any information disorder system. And we call that the 3 M's. So the message, the messenger, and the medium. And using those factors, we could still see similarities and differences compared to other public crises. And what we also noted that was very interesting was the chameleon-like nature of health misinformation, being able to change its form based on the intent of the messenger or the medium in some cases. So when we talk about the message, we're talking about the type of message and the level of accuracy. What we noticed that without fact checking is that it was very difficult to attach hard labels. Again, not just because of the scientific nature of health claims, but also because most of the things, there was a degree of truth to most of the claims. For instance, and if I walk you through the trend of misinformation, coronavirus-related misinformation in Nigeria, you would see that at first there was a tendency to downplay the existence of the virus. And that wasn't very hard to do because, I mean, at the first instance, Africa was immune or seemed immune to the virus. I mean, there was no known case in Africa till February 28th of February. And then after that, when it did come to Africa, the next thing was to say that African blood or skin was immune. And again, that was easy to say because the first African to get the virus in China survived at a time when we weren't very certain about the survival rates. And then it turned when more Africans started getting the virus. The next thing was African weather or sun does not allow the virus to survive. And it was also easy to say that because the coronavirus rate was slower than other countries, and most other countries that was hit were in the winter season. So it was very easy for people to rationalize on unfamiliar situations to make sense of the world. So after the type and level of accuracy, we also noticed a trend in most of the claims being about fake cures and preventative measures. So there were claims about salt, about lemon, citrus fruits, ginger, and the good and bad thing about it is that ginger, lemon, they're all immune boosting foods, but they are not cures. So again, we saw people using that little bit of truth to stretch it. But what's very interesting is the fact that salt continues to be a recurring theme. I try to wonder if maybe the producers of salt have something to do with this, and then also the African colonial history, right, of our cures being. I remember at least the historians say that. During our history, colonial history, we had a lot of cases whereby our cures were just demonized by our colonial masters. And so we had people using that as an excuse to say that, these cures are African and you should believe it. And then from fake cures, it turned to political claims. And politics converges with almost any concept of field of human endeavor. So we had a lot of claims about our president dying or other legislators getting sick. And when people started donating money as well, a lot of claims was about how the government was spending the money. And this is due to the distrust people have with public institutions, especially the government in Nigeria. And also in that regard, some claims actually became true, like for instance, the death of Abakari. But at the time when it started being propagated, it wasn't true. That's another thing we saw. And that also made it very hard for us to attach hard ratings to it. And then it turned to conspiracies when people understood that it was a known problem. People started throwing up different conspiracies, especially about Bill Gates, who is he's known to show up in every conspiracy theory. And then also about how even his wife, Melinda Gates, decided to divorce him because of his activities, and then the 5G phenomenon. And then, so after that, another thing, when we talk about the messengers as well, we talk about the motivations. We saw that at first, most times it started off as being very pecuniary, so very deliberate and systematic actions to increase ads and clickbaits. And there are some websites that had this very catchy information, but when you click the website, it links you to a page filled with ads. So we saw a lot of that. And then most of the times when it started off that way, you'd see a lot of battle in the comment section, and it would move to ideological kind of claims, whereby the people who are promoting it are no longer the people who had financial motives, but people who had sentiments attached to it. So they were the ones now promoting the message beyond the first motivations. And so that was very evident because the average person now became the proper promoter of misinformation. And it's very interesting to also note, and this is something we had also noticed before, that misinformation preys on human vulnerabilities like our bias, our sense of belonging. And in fact, like when people talk about their mothers and close relatives sending misinformation to them, most times it's just because people want to be the trusted means of information. So when they see something without verifying it, they want to send it to other people, so that people always refer to them when they see such kinds of misinformation. And then that also played out when we had a lot of false information about the nature of face masks and all of that. And then also, and Lee mentioned it a bit, our Africanness, the hierarchical structure of the African community, which is why we saw a lot of misinformation alluding to authorities. There's an adage that says that what an elder, at least in Nigeria, that what an elder can see standing up, a younger person cannot see sitting down, or what an elder can see sitting down, a younger person cannot see standing up. And so we can see that in sense, so a lot of misinformation also played on that authority theme of Africans, and then also the relevance of African cures. We have the history of African cures. I mean, herbal remedies, solving certain diseases, right? And then also the history of non-disclosure of African leaders, which was when our first information became very political. And then I don't need to talk much about the medium, because I mean, throughout this conference, we talked about the role of Facebook and WhatsApp and Instagram and Twitter, how the roles they have to play in spreading misinformation. But I know that it also increased because based on the digital report of 2020, the number of internet users in Nigeria increased by 2.2 million. And even with this lockdown, a lot of people were online. So I even expect there to be an increase in the coming months, right? And so all of these things were things we saw. But and I'd just like to throw this out there that Reuters Institute and University of Oxford released a digital news report, but there was no information about Nigeria, and we would love to see that. So please work with us, Dubawa, and release more data about the news consumption habits of Nigerians.
Thank you very much, Ebele. We have two very good questions for our panel. One is from Alexander Capro. I hope I have pronounced that correctly. He asks, if it's a he, that is, I'm not sure. What has been the toughest challenge you had to face in fact-checking coronavirus-related fake publications in each of your countries? So this probably speaks to the medium, but and I know Ebele has touched a bit on it, but maybe quickly, Rabiu, you can give us your experience.
This is a difficult one, because there there are some misinformation that you would encounter that sometimes you cannot debunk in the shortest possible time, because these information, they go viral, and sometimes you would want to quickly put out the information to be able to curtail the effect that it would have on victims or vulnerable people who would want to act on them. You might want to quickly contact the necessary resource people to give you information. But there was one particular claim that till date, it looks like there's a challenge in terms of providing the necessary ratings for it, where someone claimed that for those who had recovered from the coronavirus, it could be possible that they might still suffer lung infections and might even be infertile after they have recovered. Now, we tried reaching out to the World Health Organization, we tried reaching out to the Ghana Food and Drugs Authority, and because the virus is so young and there has not been lots of research work done to actually ascertain the impact and how it would live on after people recover from them, it is not conclusive what would happen to those who have recovered from the virus. So it's taken forever. We've put out a report more like an explainer, but it was a difficult one in terms of providing ratings. So mostly we would say it's no evidence. We'll put no evidence attached to such a claim. So these are some of the difficulties and the realities. It's not like it's a black and white situation. It's binary, where it is either true or false. There are some gray lines in between there that fact checkers would have to think through and see how they can rate them and put out the right information to the public.
Thank you, Rabiu. Eric, what has been the challenge fact checking these publications?
So I'd say the biggest challenge is just how many there are, because we've seen a huge proliferation of a lot of these false publications. But the main thing that we've also seen is a lot of times they mention specific entities and specific organizations. And when we reach out to these organizations for comment, a lot of times they're very happy to respond and say, we have no idea what this is. So actually I'd say the first COVID-19 related false story that we got was about a university in Kenya and how medical students at that university had developed a vaccine. And we did some research on that site, and then we found that it actually had been published on another site where it said that the students were from a university in Ghana. And then another instance, it was published where it said the students were from a university in England. And so a lot of times there's a lot of repetition, but then we also keep seeing some new variations of these false publications. So what they try to do is play the numbers game, where they spread out as much false information as possible and hope that one actually catches like a fish. So it's almost like a trolling ship, where they cast out the net and then hope that they lure in one person. And as Ebele mentioned, one of the things that we've seen on these publications is they tend to be very ad-driven. So every click that they get, it turns into revenue, which they then use to create other false sites and publish more false information. So it tends to be a very self-propagating cycle. So once we put one down, it shows up again, and they publish something else, and then they set up another domain, create another bunch of articles, publish them, and then it continues, rinse, repeat, and then they keep publishing. So because of the ease of creation of this false information, it becomes a big challenge for us to stay ahead of all of these things. And also the fact that this content is manifesting in lots of different places at the same time means that we have to loop in people in these other countries and tell them this is something you need to watch out for. Because if we check something and it's in Kenya and we publish it on our site, it's really hard for someone in Nigeria to see the same fact check. Or it's also really hard for people to fight the false information where they are. And then for the longest time, I think the elephant in the room was COVID organics, which touched on a lot of different preconceptions and biases of false information. So here you had the government of Madagascar pushing this cure, and then Tanzania followed, and then a bunch of people said, if you fact check and say it's not an effective cure, you're anti-African. So they were touching on lots of biases. And because of that, it was manifesting in lots of different and lots of very interesting ways. So eventually, we actually were able to get connected to the World Health Organization, and after the WHO agreed to test the COVID organics, the false information started to die down. And in part, it speaks to just how much skepticism Africans have of Western organizations, including people like the Bill and Melinda Gates Foundation, where their names keep popping up and they keep showing up in lots of different platforms where they say, these are obviously people with an agenda, and that's where we as fact checkers need to tread very carefully.
Thanks, Eric. I'll come back to you on a question about opposition to vaccine that we have been asked. But Ebele also mentioned something about religious figures or figures of authority. And we have a question from Jules, who asks, religious leaders or figures are causing a good amount of falsehood in some African countries. So how do each of you handle this? So maybe quickly, Ebele.
So I would say that I think every fact-checking organization is trying to do better in identifying the key actors and people who are promoting false information, whether directly or indirectly. So what we're trying to do, and this is just to talk about it briefly, and I'm sure other organizations as well, is to try to identify those actors. It's not very easy. I mean, it's easier to identify them, but in most instances, it's harder to work with them because they are coming from a very strong place, a very faith-based place, and most times they believe that they have the information. So what we're trying to do is to use our fact checks. So even as we're trying to reach out to them, we're also trying to use our fact checks to sort of not really replace, but at least if we put our fact checks out there, we're hoping that people see our fact checks as well, and then they can decipher between what to believe and not to believe. There's also an increasing skepticism for even for blindly believing religion now in Nigeria. So we're seeing a lot of younger people trying to even question what their leaders are saying. And I think that's something we're trying to do, to ride on that wave, to let people know that you can retain your faith while still being practical about issues. So again, it still boils down to education, really.
Thanks. Rabiu, have religious leaders been a challenge in Ghana? Okay, sorry, I think as Rabiu prepares...
religion is a very polarizing topic to discuss.
Sorry, please go on.
Okay, so as I was saying, yeah. So religion is a very interesting topic to talk about when it comes to debunking disinformation around COVID-19. It's faith-based. It's largely based on someone's belief. So if it is not narrowed down to a specific claim, we find it's a big challenge to delve into that particular sector and do the debunking of disinformation. There was one that came up earlier when Ghana first recorded cases of coronavirus, where we had the chief imam here in Ghana kind of give out some counsel to Muslims in the country and advice on how to use alcohol-based hand sanitizers. There were concerns that because Muslims don't consume alcohol, then why should they even use the alcohol-based hand sanitizers to protect themselves from the coronavirus? And the chief imam came out to give some counsel and some advice to Muslims, saying that if a Muslim finds himself in a very dire situation where alcohol is the only means of survival, maybe the person can even go for that. But it was circumstantial, if I could put it that way. But it was picked on by some media outlets and they ran with it for clicks, saying that the chief imam had counseled people to drink alcohol, counseled Muslims to even drink alcohol. So this time round, because there was a specific claim, you can deal with it. You can cross-check with the office of the chief imam and see if you could debunk this disinformation. There have been also others about Pastor Chris. His video went viral here in Ghana. I'm sure it was same also in Nigeria and even around the world, where he made some pronouncements about 5G. So with this, it is specific. He mentioned something specific about a claim, and that could be debunked or confirmed. So this time around, fact checkers can go in there and do their work in terms of confirming or debunking it. But there are others, which is more, should I say, spiritual, where someone would say he's prophesying this, he's prophesying that, he had dreamt about something which could possibly be a cure for the coronavirus. We've heard of people saying they've been inspired or they've been guided by the Holy Spirit to say that if you put together a particular concoction and you drink it, it could possibly help cure the coronavirus. This one was specific because he mentioned some products that you would boil and use in preparing the concoction. So we put out the report here and we helped debunk it. There were others even also in Muslim-dominated areas where the person was speaking in a local language and was advising people to basically chew onion as much as you can chew, and it could help cure the coronavirus. And this time around, it's a specific claim, and if you can cross-check with the various authorities quickly, you can put out a report, and through collaboration, you can let it reach to the masses who have already encountered this voice note or the doctored image, and you can help put out the right information.
Okay, thank you, Rabiu. In the interest of time, I'll take one more question. Actually, I see Hugo Williams asks if we found ways of tracking misinformation on closed networks like WhatsApp, but I will direct him to the next panel that is coming up that is entirely related to WhatsApp. So I think because of time, I can ask one question and then we can make some closing remarks. But I think the question I do want to ask from all of you is, there has been quite a lot of debate at the Global Facts Forum this year about sustainability of funding. And essentially because we've seen a lot of big tech firms get involved, but that may not always be there. So how do you think fact-checking organizations should look to approach the future? I could start with you, Eric.
Yeah, so sustainability is always something that we have in mind because we understand that the work that we do is really hard to sell as a product. And one of the things that we've also seen is that if we do decide to take advertising or do actually promote content in certain ways, then it actually brings our editorial decisions to question. So one of the things that we have actually tried to do is to sort of save up on the income that we're getting, because actually a big chunk of the income that we're getting is from our partnership with Facebook. where we have a third-party relationship with them, where we look at content on their platform. And we understand that it's not, because this is actually something we talked about on my first panel on platform and fact-checking at internet scale, where we recognize the fact that we're not going to do this forever because they don't want to keep, they wouldn't want to keep running a program like this forever. So we have to keep in mind that as it is now, we rely a lot on the charity of strangers, so people who are interested in supporting fact-checking work. So one of the things that we are, at least we're trying to do, is to find ways to support our work by investing in skills and quality of content, so that we can position ourselves as to do fact-checking as a service. So that can get really complicated, especially considering that we are essentially journalists with a very specific mandate. So considering that there's newsrooms that need to be doing what we're doing, one of the things we can do is to sort of partner with them, because they already have the revenue models in place, to find ways to build on their internal processes and be essentially trainers of these newsrooms. And I think that's one thing that Africa Check has done really well with TriFacts. And the other thing that we could do as well is to sort of build relationships with regulators. Like in Kenya, for example, we have the Media Council, and one of the things that they do is they provide grants for the sort of work that we do. So we can't keep taking grants forever as well. So it's a really big conundrum, and it's a conversation we need to have internally and also as a network. How do we build on the work that we're doing and make sure that it's sustainable?
Okay, thank you. In the interest of time, I'll let Eric have the last word on that, but maybe I can come back to each one of us to give us a sense of what they think about the work we do as a closing remark. So, Ebele, I could start with you briefly.
Okay, so I would say that I think what I'm looking at in the future is for us as fact-checking organizations to conduct more research, African-based research ourselves. And that's just because we need to understand the problem before we can even prefer good solutions. As we're working, we need to know what's working well first. And especially because historically there's been a lot of emphasis placed on the producers of misinformation. That's the politicians, the businessmen, and even the average people. But we need to even have more specific information about the demographic and situational factors that affect, like the sex, the age, the gender, all of those nuances, cultural nuances. We need to not just be talking about it based on our experience, but we need to have research, quantitative evidence of these things happening. We also need data, more data from the tech organizations. I know that, with our partnership with Facebook, we're seeing more, but still need to do more. Twitter especially, because, I remember trying to get more information about the number of, I was trying to get the trends of coronavirus and its related what's in Nigeria. And with CrowdTangle, I was able to get some figures, but I got nothing for Twitter. It was just not, I couldn't get the total for per month. So it's very important for this, for tech organizations to release more data, and even amongst our fact-checking organizations, trying to, if it's possible, to have like a database. Understand that the practicality may not be there, but have a database whereby we could see, the trends, and that would also help us to be very proactive in our approach. And finally, we need to push beyond just fact checking to literacy and responsibility. So people need to care more about fact checking, and we need to encourage people to do so.
Thanks, Ebele. Rabiu?
Yeah, I'll dovetail my final remarks with the comments by Ebele with regards to the responsibility of social media giants. I think it's important they know that it's their responsibility to ensure that their platforms are platforms that are not platforms that do not allow people spread disinformation and misinformation, because these are being weaponized to spread chaos on the continent and even beyond. They shouldn't just concentrate on Western countries in terms of providing solutions and helping deal with these problems, because it is also real in Africa. In various African countries, we've seen how disinformation is being weaponized on social media. Twitter, Facebook, Instagram, you just name them. So it's important they are up to that responsibility. Now, the second issue I'd want to mention quickly is that Africans must appreciate that for good journalism to thrive, they must invest in it. So people should be ready to give out tokens to ensure that good journalism thrives. And fact-checking is good journalism, ensuring that you are tackling, sanitizing information that is put out there. So people should be up to this responsibility. And the final one is the spreading of media literacy, the spreading of and educating of journalists and basically the youth on the continent, because we have a very youthful population, to be up to it, to know how to use digital tools to easily identify this information online so they are not swayed.
Thank you very much, Rabiu. Eric, to close the session for us.
Okay, so I think at some level we have to understand the sort of networks around us that are used to spread information. And one of the main things that we also need to understand is that we need to manipulate the networks of trust, not in a bad way, but in a way that enables us to plant our facts and our factual information in there to make sure that the information people are consuming is actually correct. So we need to understand where the false information is circulating and why it's circulating and what we can do in our different contexts and with the people around us to make sure that even as the false information circulates around us, we don't just sit on our hands and hope for the best. We can actually do something about it. Because I think this is one of the main things that we've seen, at least in the online conversations that I'm part of, where people keep looking around and asking, where is a savior? We as fact checkers need to take up this mantle and try to figure out how we can plant the false information in an effective way and make sure that it germinates and actually leads to the blossoming fruits of truth, I'd call them. Thanks.
I couldn't have said it better, Eric. Thank you very much, everyone who joined us. Apologies for the questions you weren't able to take. Dapo wanted to know about your experience with media organizations. Alexander wanted to know about vaccine hesitancy in West Africa. So we are happy to take those questions offline. So I think our contacts are available. But for now, thank you very much for your time and thank you for joining us. I wish you a fantastic rest of the day.